You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 48-year-old woman presents to a health facility with complaints of chronic dryness of the eyes, dryness of the mouth, and generalized joint pains. She also indicated to the clinician that she experiences difficulty when speaking and, of course, during swallowing of food. Now, based on history taken by the clinician, it was realized that this patient has rheumatoid arthritis. And of course, on physical examination by the clinician, yes, the patient, yes, conjunctiva were dry, yes, the mouth was dry, and then of course it was also having some kind of swelling, okay, around the parotid gland area. So based on these presentations, the first question for us is that what is the most likely diagnosis of this patient case? My friends, your answer is Sjögren syndrome, and precisely is going to be a secondary type. So secondary Sjögren syndrome. My friends, the reason is simple. Yes, of course, you have the primary Sjögren syndrome, you have secondary Sjögren syndrome. Now, whenever the Sjögren syndrome, okay, yes, is coexists with what we call another autoimmune disorder, then it becomes a secondary type. So what we mean is that, yes, already based on this individual's history, was having rheumatoid arthritis, and then also having some kind of symptoms which resemble Sjögren syndrome, then of course it makes it secondary Sjögren syndrome. Okay, which of course we see it in about 30% of the cases of individuals with Sjögren syndrome. Although largely individuals with Sjögren syndrome may not have any coexistent, autoimmune disorder, and so it becomes primary Sjögren syndrome. So as far as this patient case is concerned, because having the existence of another autoimmune disorder, for instance, rheumatoid arthritis, it could also be systemic lupus erythematosus. Yes, these things will make it a secondary Sjögren syndrome. And my friends, why are we saying Sjögren syndrome even in the first place? The reason is simple, because Sjögren syndrome, one thing is that it's an autoimmune disorder, okay, which of course, will work against mainly what we call these glands which secrete, these products, largely those which will secrete saliva, okay, so they will attack, yes, both the major and minor salivary glands, and then also attack what we call the lacrimal gland or the tear gland. And that is why classically you realize that there will be dryness of mouth, okay, there will be dryness of what we call the eyes. Okay, now one thing is that it should be a chronic thing. Now, just having the dryness is not diagnostic, so to speak. Yes, it's highly non-specific. So having it chronically, yes, beyond 3 months or so, then of course it makes it, more likely going towards this case. And understand that it is an autoimmune disorder, and therefore it makes sense that we need to check some kind of autoantibodies, okay, in the body, okay, so that we can make a definitive, diagnosis. Now, the next thing is that if you've seen these things, then what are the manifestations? Yes, largely. Yes, let's explain the manifestations. Now, the point is that, we talk about having that kind of distraction of what we call the lacrimal glands. And that is why one of the things that you'll be experiencing, okay, will be, of course, what we call the keratoconjunctivitis sicca. Okay, so what will happen is that, yes, there's going to be that kind of inflammation of the conjunctiva. Yes, there's that dryness over there, and that is what we are going to see. And one of the complications that one may experience, yes, if there's dryness of the eye, then the cornea, yes, could get damaged, yes, with time. And then because the tears they don't flow, then what's going to also happen is that one may be susceptible to, of course, some of these, eye infections. Okay, that would be one of the things that uh, one may experience. Then, yes, another gland, yes, by way of the major salivary glands. Yes, you know the major salivary gland, we talk about the sublingual gland, submandibular glands, of course, we talk about the parotid gland. And that is why one of the things, okay, which may, be a thing which, of course, as far as this case study is concerned, yes, we presented it with, of course, swelling or enlargement of the parotid gland. For one thing is that we see that there's dryness of the mouth. Meanwhile, the parotid gland has become enlarged. Yes, not only that, even all these minor salivary glands in there will be issues over there. Now, understand that when someone is a bit nervous, okay, then of course, sometimes these, saliva secretions, yes, will go down, yeah, because sympathetic stimulation takes over, okay. That one is quite, normal. But this time around, we are talking about it happening chronically, yes, beyond 3 months, okay, such that all these auto antibodies, okay, self antibodies which fail to recognize, okay, the self, antigens will begin to, of course, mount this kind of immune response, okay, attacking all these, glands. And that is why, yeah, the saliva that will be produced will also reduce drastically. And so one of the things is that whenever saliva production reduces drastically, there will be difficulty in speech. Okay, there will be difficulty in articulating your point. Okay, that's one of the things. And then, of course, one may be susceptible to dental caries. Okay, generally, yes, infections as far as the oral cavity is concerned. Okay, these are the things that one may, of course, get be prone to, and that is what we mean by xerostomia. And my friends, one of the things that we realize is that sometimes this, talking about this Sjögren syndrome, one thing we realize is that it may have extra glandular manifestation. And one of the key things that we see is that, yes, generally, yes, joints everywhere, there will be pains throughout. Now, understand that as far as this case study is concerned, yes, the individual was 48 years. Yeah, usually, yes, around age 40 to about age 60. Yes, that's where predominantly we see these conditions, which of course we see it more in women, yes, than in men. Yes, the environment could play a role, the interplay of the environment, genetic factors. Yes, all these things could play a role in, of course, sometimes some kind of infections, okay, some viral infections and all that. And even sometimes you having a history of, another autoimmune disorder could predispose you to some of these things. Now, having seen this, then what is the way forward? Now, the way forward is that, yes, yeah, generally, yes, palliative care could be, the first choice. Now, the point is that, yes, the symptoms, the signs that the individual is experiencing, we need to work around it, trying to resolve it. Okay, so for instance, if, the tear you are not producing, yes, enough, then of course, there may be artificial tears to help you. Okay, otherwise, yes, as I said, there will be that kind of complete dryness, and then of course the cornea could get damaged. Yes, you may have a lot of, ocular issues. And then, of course, in the case of saliva, we need to get some kind of saliva substitutes, artificial ones, to help in that regard. And other things to stimulate, yes, especially things which will help stimulate this parasympathetic activity. Yes, parasympathetic mimetis perhaps could help, okay, to increase, of course, the tear and, of course, the saliva production. But my friends, because the immune system has become so exaggerated, yeah, then there could be the need to manage with some, immunosuppressants. Okay, may help some corticosteroids and all that could help reduce, okay, the gravity of the way the immune system is responding to certain things. Okay, so these are some important things. Now, importantly, as far as the oral cavity is concerned, whenever you are saliva you cannot produce enough, then what will happen is that, as I said, oral infections and all that, and therefore there will be the need for you to have a proper oral care. Okay, every now and then, frequently see your dentist, okay, to help with some of these, management. So I believe you find this meeting very helpful, and of course you are going to, yes, work around it, so of course to understand these concepts. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.